Testing, just testing sound. 5, 4, 3, 2, 1. Can anyone hear me? Just want to see if I can get some comments in there before I start speaking in earnest. Testing sound. Anybody can hear me? You can hear me. Okay, great. Then let's begin. So greeting med students, residents, everything before and after and in between that. I'm Dr. Emma Husain, and I work for Med School Tutors. My background is in orthopedic surgery. And today I'm going to talk about confidence. It's going to be a fairly short session, but I have 3 major takeaways from this that I'd really like to get across. So, and if there's any questions, type them in the chat box. If you like what I'm saying, give me a thumbs up or a love or anything else that you want to contribute. One of the things that I've noticed in myself and also in the students that I tutor and students that I've taught over, at this point, probably 16 years, is the lack of confidence. And I feel like it comes up in 3 places, and I wanted to just give some general advice on perhaps how you could create more confidence within yourself. There's the confidence that you need when you're taking an exam. Typically, I'm referring to the steps, but maybe the shelf exams as well. And that kind of confidence involves the moment where you don't really know what's going on in the question. You recognize some of the words and a couple of general trends, but you really aren't sure what's going on with the patient. And I feel like a lot of students without confidence give up in that moment, and they kind of lie down and roll over and play dead. And so the question wins. I want to address that. I want to address how to be confident in your rotations, whether we're talking about medical school or residency, because I think that was one of the most demoralizing experiences of my whole life. Was probably those 2 clinical years of medicine. It got better in residency, but there was still this serious lack of confidence that I felt pretty much 100% of the time. And that also includes patient interactions, and then specifically how to be confident in an interview, so a residency or a fellowship interview. So that's what I'm going to talk about today. And let's start out with the exam, because I think a lot of you are probably preparing for one of the step exams. And, you've been doing UWorld, you've been studying, you think you know what's going on. You take an MBME, perhaps particularly one of the later ones that's got a lot of verbiage. It's very, languagey, right? And a little indirect and oblique with the language. It's not buzzwords at all. And you get to this question that you've never seen this graph or this table or this chart or, and this is the point where I want you to have this mantra that is, I kind of don't know what's going on here, but I know a lot. And I'm going to use like every single piece of what I know, plus some general logic that I learned from my parents and my grandparents and, gravity and just things that I know. I'm going to put it together and I'm going to choose an answer. And what I've found reviewing questions with students is that they do tend to roll over and play dead and just pick C and move on. And if I actually get them to sit there and sort of put them on the hot seat with that question and say, well, what about this word? What does that make you think? And what about this part of answer choice D? Does that look good to you, or does that look like a rubbish answer? And often the student either gets it right or gets it down to 2, at which point, if this were several questions that had this particular kind of moment, getting it down to 1 and 2 could pick you up quite a lot of points, right? If there's 10 questions that you're confused about, you don't know what's going on, and you're able to get it down to 2, that's probably 5 points, 5 more questions that you get right. So lesson 1, do not roll over on any exam questions. You fight like a gladiator to the end, which does not mean wasting time. So there is a fine line, But this idea of, oh my God, I don't know what this is. No, you should know everything you need to know to answer most of the questions. And if a question really gets you, then you just leave it and you move on. And that's also part of confidence, is not feeling like one mistake completely labels you and scars you for life. And now the whole, the whole sort of, the test is completely broken now because you lost your confidence because there was a question that you didn't know. Okay. So do not roll over and play dead during confusing, weird, oblique exam questions. Fight like a gladiator, but don't waste time. If you need to, mark it and come back. That was the easiest part of what I was going to talk about. The next part is really hard, and it's hard for me because I actually don't think I was a very confident medical student or resident, and I don't think I'm even particularly the most confident person that you might meet. But what I do know and what I do appreciate are those people that are willing to let themselves be themselves and not try to fit into any categories. For example, there was this sort of, I did orthopedic surgery, so there was this impression that you had to be male and, rough and alpha, which isn't really something that I naturally can do. And it was certainly a box that I tried to fit myself into. I think I tried to be some sort of like female, warrior kind of thing. And then that's not who I am. And I think what happened was it ended up being a fake kind of confidence, right? That I was putting out there, that I was tough and I was strong and I was confident. That's not really the kind of confidence I have. And confidence is not mimicking what you think someone else shows in their manifestation of confidence. It's truly accepting who you are and honoring who you are and being comfortable with that and not trying to fit into those boxes. Because I feel when you do try to be something that you're not, super serious, incredibly intellectual, very fierce, whatever the older, I looked like I was 15 throughout my whole residency. It really didn't help. But trying to do those things, I think, weakens who you are. I think it's much better to say, you know what? Yeah, I look 15 and I'm going to be the junior resident operating on you today. Don't let the way I look fool you. I work very, very hard. This is the attending. He's great. We're going to be here together. Do you have any questions? And just truly honor the fact that, yeah, some of these patients were a little horrified at what appeared to be, this like kid that was going to be operating on them or casting them or whatever it was. So be yourself and don't try to fit into a model of what you think a good resident or a good physician is, because you'll really come off as less than that. Because if that's not who you are, it's just going to be a terrible job, right? The only thing you're really good at is being yourself. So if being yourself is humorous, great. If being yourself is not humorous, then don't be humorous. It'll be terrible. Your jokes will be the worst. Everybody's going to be uncomfortable. Don't do that. If who you are is very artistic, very soft, kind, soft-spoken, be that and honor that, and don't feel ashamed that you don't look like a doctor on TV, or you don't look like your chief resident or your attending, because you can't be those people. The only people that can be that are them. And you have to really honor your own style and find your own style. And that includes honoring where you're at in your progress through the field of medicine, which is my second really important point on this topic, which is that if you're a medical student, you really don't know everything that's going on around you in the hospital. You don't know the protocols, you don't know drug doses, you couldn't prescribe them, even if you did know them. There's patient diagnoses you haven't seen, ways of following people up that you don't know. That is appropriate for where you are. Do not be ashamed. If your attending asks you a question about anything and you don't know the answer, then I think that's okay. I think pretty much any question that your attending could ask you, that you don't know the answer to should be honored. You know what? I don't know the answer to that. I think I need to do some more reading on that. Or I don't actually truly know the answer to that, but may I guess what the answer might be using my best logic and intuition? And yeah, this shame, I don't know, the stuttering, the blushing, I don't think we ever needed to have any of that. Excuse me. And God knows, when I was a resident, if I got something wrong, I felt terrible. I would ruminate on that for days. Oh, I should have said this. I should have said that, but I think it's simple. I don't know, or I don't know that, or I'm afraid I don't know that. I'm sorry I don't know that. I think we need to be able to say that with more confidence and more honesty about the fact that a medical student is still learning. And yes, the bar is higher for a resident, but a resident's still learning too, right? And so you should not be equipped with all the knowledge that your attending has. You're there to learn. And I think just being that person, I'm a student, I'm a resident, I am not the one that knows everything. I'm going to do my very best to help you. And anytime I don't know the answer, you say to your patients, I'm going to ask for help. I'm going to go find out. The reason I entitled this discussion, You Can't Fake It, but You Can Get It, is because pretending to be confident and making up an answer for your patient so that they think that you know what's going on, I think that's terrible medicine. I think that what we need to do is say, that's a good question. I don't know the answer to that. Someone does. I'm going to find out for you, or I'm going to look it up. I'm going to get back to you. And we just need to stop promoting this idea that doctors are omnipotent and infallible and that we should know everything. So if you can be comfortable with the fact that you don't know everything and that's the right place for you right now, that's like who you really are, then I think you can be more confident. Some things you know, some things you don't know. You're there to learn. Honor your time as a student and don't force yourself into the box of trying to be like a mini me physician, because you're not there yet. And you will be there one day. One day you'll know what you need to know to be an attending. And that's a process. And to expect that you have to know that at the beginning of the process is really, I think, incredibly unhealthy. It's unfair. It's not good. It's not good. And if you accept that you're a work in progress, I think you can be more confident in the absence of knowledge, which is a big point for me. The other thing that I wanted to talk about that actually comes to both of these things, both exams and like performing in residency or clinical rotations in med school, is this weird idea, and I did touch upon this in my other video, that you're comparing what you know about yourself inside, which is your dirty, nasty, secret self, right? Pathetic secret self, to someone else's manifestation of what they're like. I only studied 2 hours and I got a 96, and I baked 7 loaves of bread this week from scratch. I even ground my own flour. This is just, I think, unrealistic to compare yourself to what someone's presenting. And I feel like a lot of my students, they need the reassurance at all levels that you're not the one guy that's confused and sort of can't find his way. Everybody has that to a certain extent. And I feel like as students, and tell me if this rings a bell, a lot of time I felt that everybody could see so clearly, oh, this is how renal physiology is, or this is how we make a differential diagnosis. And the idea that everybody's seeing it clearly except for you. You're still kind of putting it together and they're this finished product. And that's just false. So forget about that. Do not compare the worst thing you know about yourself to someone else's best presentation of himself or herself. It's not a fair, it's like comparing a selfie taken on the subway to something that was airbrushed in a studio. It's just not comparable. Yeah. So you're just as confused or just as knowledgeable as everyone else around you, more or less. And you don't need to know everything to be appropriate for where you are, to be right for where you are, and to move forward the way that you want to move forward. I saw that Faith wrote a comment that I just love, which is, be comfortable being uncomfortable. And that's a lot harder when you're younger. I think as you get older, you develop this sort of self-satisfaction and sense of self that kind of helps you along, as opposed to sort of toppling over with any breeze that sort of blows on you. But yeah, be uncomfortable. I don't know the answer to that question. And I don't actually know the answer to the question that's coming after it either. And wow, I really need to read about Lefort fractures, because I just got 3 answers in a row wrong. Okay, just let it be out there like that and move on from it. And people will be very drawn to that. It's a very comforting sort of quality when you truly are at peace with yourself, even when you disappointed yourself a little bit or you didn't live up to your own expectations. Get comfortable by being uncomfortable is excellent. Couple of other things for the residency, and then I'll just talk about interviews. Play your strengths. So if you are, you want to go into ENT, you really know ear, nose, and throat, anatomy, physio, pathology, then you're going to do well in those rotations and accept that as you do. And maybe if you're like most medical students, OBGYN is incredibly weak. I find that over the entire student body that I have, OBGYN is the one that's the weakest. And accept that. And rather than feeling humbled or stupid, just say, you know what? I haven't done a digital exam. Can you help me with this? I don't know exactly what the protocol is for shoulder dystocia. Could we go through it? And show enthusiasm for your ignorance and the fact that you're in there to fix that and learn more. So ask for help, ask for guidance, own your level. Yeah. The last thing I'm going to talk about, unless anybody has any questions, is interview processes, which could be residency, could be a med school interview, could be a fellowship. And the idea that these are like auditions. So they're looking, you think, they're looking for a particular kind of person for their internal medicine program or their neurosurgery program. And you have to fit into that box, which I find incredibly confining. And it was definitely something that I mistakenly did. I am not a good version of Joe and Maria and, Dr. Lee and whoever else I've ever come in contact with. I'm really just a good version of Emma, really actually the best version, because I'm the only one doing Emma Husain. And that, I think, is what you need to bring to an interview, not this box and you're going to fit yourself into it so that you look like an orthopedic surgeon or a dermatologist, but rather just be there as yourself. I hate olives. I enjoy snowboarding. The last book I read was about Roy Cohen. Just whatever you really are, be that person. If they ask you a question you don't know the answer to, like, where do you see yourself after residency in a suburbs in a big city hospital? How long do you see yourself practicing? You say, I don't know. I don't know yet. I'm open to a lot of things. I'm still a work in progress. I could probably answer that question, but in 2 years, that answer will be out of date and it will no longer reflect me. So in all honesty, I have to say, I don't know, which again is much better than lying and giving an answer that you think they want, because you don't know what they want. So why not just be yourself? Because at least that will be truthful. It'll be honest. It will come across in a certain feeling, because when you're trying to be something you're not, you get very tense. Your face screws up. you don't smile and you're sweating, and it's just, it feels bad to the other person. So if you can just relax and be yourself and answer the questions you can answer, and faithfully and sincerely not answer the questions that you cannot answer, I think that goes a long way to telling them that this is somebody that's mature, this is somebody that knows himself or herself, including knowing what you don't know. So those are my main points. And I just want to recap, because if you could just take away these 3 little pieces, then I think that was everything that I wanted to give you today. So the first one is, do not roll over and play dead during an exam question. You can do this and go for it. Be a gladiator. Don't waste time. Second thing, own your level of training. If you're a 3rd-year medical student, most of the things that are happening in rotations, you haven't learned yet, or you haven't learned it that way. So it's going to be all them speaking to you and giving you information, and maybe you not being able to answer many questions at all. And own that. Don't pretend that you're supposed to be a mini doctor. Own your level. And then continuing with that, but in the interview section, be yourself. Just be yourself, because you don't know what they're looking for. And wouldn't it be terrible if they were looking for someone just like you, but you decided to act like someone else, so they didn't pick you? You know, I mean, there's obviously limits to that, because, you know, if showing yourself ends up being something incredibly negative, I don't think that's going to work for you. But whatever your true personality is, I think you need to own that. And I think you just need for it to be okay if you don't know. It's okay to get things wrong. It's okay to make a mistake if you rectify it and you're honest about it. And all of these things, I think, create much more of a feeling of power than putting on this fake cloak of confidence where you're going to talk with a deep voice and, you know, poof your chest out and be very definitive about things that you don't even know what they are. No, just don't do that. Just relax, be yourself, make mistakes, honor your mistakes, admit your mistakes, rectify your mistakes, and and own your level. So that was it. It was a short session because there were just those 3 things that I wanted to say. Excuse me. If there are any questions, I will take a question or 2. There are no questions. Okay. Thank you so much for tuning in. I really appreciate when people come and listen to these Q&As, and makes me feel like somewhere in the world, somebody is relaxing and getting comfortable being uncomfortable. So that's great. Excuse me. Be yourself. If you would like to contact med school tutors, you can email at hq@medschooltutors.com. We'll type it in the chat box as well. And if you would like to call us, our number is 212-327-0098. And I'm just typing that in right now. Hard to multitask. 212-0098. Yeah. So if that is all, then I encourage you to go about your day with confidence and be yourself. Don't fake it. And I think all my best. So, all right. Thank you so much for tuning in. And I'll see you next time for something else. This is Emma Husain signing off now.